Hi, everybody. I want to welcome you to our webinar today. My name is Rachel West. I am the Director of Education here at IntelyCare, IntelyEDU, and I'm here with Sean Carney, who is our VP of Partnerships. Before I get us totally rocking and rolling, I'm just going to give people a minute to get in, get situated, get, comfortable in your chair. Happy Monday. Um, Definitely want to hear from you all. Where are you calling in from today, and where are you calling in from? So I am north of Boston. Here, it's sunny, it's lovely, it's warm. I'm excited for this afternoon. Maybe a bit of pool. All right, Georgia, welcome from Boston. So you can just type those in the chat section there if you're connected. We'll get going here in another maybe one more minute.
Ooh,
Hi, Mary from Rochester.
that's all Bahamas.
Bridget, I'm going to be down in Bermuda soon. California, Pennsylvania, Cleveland, Minnesota, Bay Area. Bay Area, it is early in the morning for you. Long Island. Much of my family in Long Island. Love it. Or as they used to joke with me when we moved away, Long Island. I love it. I love it. Welcome. Welcome, everybody. And Florida. Oh, this is fun. It's so nice to see so many people from all over. I'm very excited. Hi, everybody. All right, so let's get started. There's a bunch we want to get covered through here. I'm going to take care of a bit of housekeeping stuff, and then we'll dive right into what you really are here for, right? So you are here. If you're lost, don't be lost. You're here in why nurse education is critical to the success of your facility. So we're going to talk about some of those things. Again, I'm Rachel West. I'm the Director of Education at IntelyCare. This webinar will be recorded and will be shared with you after the event. So do be sure that you check your email for the link to view the recorded webinar after. We want to hear from you, though, so please do make sure that you are putting in questions in the Q&A area. I'll keep my eyeball kind of on those, and Sean will kind of keep an eyeball there to see if there are any questions. In addition, we'll make sure that our emails are available to you all as well in case you have specific questions about what we're talking about today and you want to reach out to either one of us. All right, so I think I don't know. Let's get started. I guess I'll, if that's okay, Sean, I'll start with an intro, and then I want to hear from you and sort of, all of that. So again, Director of Education. I've been a nurse. I'm a registered nurse. I've been a nurse for, we're counting in decades now, 23 years. I started my career in the intensive care unit and quickly realized that I needed to be in education. And over the last 15 years or so, have spent my time really focusing my professional self as an educator. So I've worked in all different kinds of levels of education, from high school, career and tech ed, through postgraduate, certificate, building and leading academic institutions in pre-licensure, post-licensure education, and now in continuing professional development for nurses and nursing professionals. So I have a Master of Science in Nursing and a Master's in Healthcare Administration. So I kind of bridge the world of nursing and business. And I'm a PhD candidate, actually, for a PhD in nursing education. So lots of experience, lots of things I'm looking forward to sharing with you all. But that's a little bit about who I am and why I'm here. All right, Sean, you want to tell us about you a little?
Great. Thank you so much, Rachel. Appreciate it. My name is Sean Carney. I am a licensed nursing home administrator since 2003. I also have my master's in healthcare administration. So I've always taken education seriously within healthcare and just in growing and in life. I'm a former owner operator of skilled facilities for the previous 7 years. And I recently sold those facilities, and I'm transitioning over to IntelyCare at the end of last year. And I am excited for the topic of our conversation today because it happens to be something that I wholeheartedly believed in. I still believe in, but it was a core principle in the way that I either managed facilities or when I was an owner operator, the way that I led facilities in development, in personal development, in census development, in culture development within the facilities. I've always believed that continuing education is vitally important.
Awesome. Awesome. Well, we're going to have a great conversation. So, for those of you who might not be familiar with IntelyEDU, IntelyEDU is a division within IntelyCare. I joined IntelyCare about, oh my gosh, almost 2 years ago now. It feels like a hot minute and also several lifetimes ago. So it's funny how time is changing as we go on. But anyway, IntelyEDU is a division within IntelyCare. We have several functions and a few real communities of interest is what I like to call them. We certainly have our community of interest of our internal IntelyPros, the people who work for us as professionals out in the field. We strongly believe as a company in education as the foundation of everything that we do. And we wanted to provide an opportunity for our staff to have that continuing education that they need in order to maintain their license and certificate. So we manage a portfolio. We have about 200 or so courses in our library that we maintain to allow people to take those. They're ANCC accredited. So those of you familiar with education a little bit, ANCC is our our accreditation body that allows us to provide that continuing education. So they're all accredited. Our IntelyPros can access those. They're free to our IntelyPros, which is an amazing benefit, and they're very well loved and utilized, which is terrific. So that's our first community of interest, our IntelyPros. Our second community of interest are the public. So the public do have access to a library of courses. We also have a variety of certificates for professionals in healthcare. Our professional scheduler certificate is out there for people, for example, who might want that. And then we have a third arm, which is, I think, a pretty important differentiator for IntelyCare. Whenever we have issues, and they happen, right, with per diem and contingent staff, we have a whole mechanism of retraining, just-in-time retraining, that if you were here for our first webinar, you heard a little bit more about. But so we have that in partnership with our quality assurance nurses. So IntelyEDU is the place where we house all of our education-related content and expertise, and we have a small team of people that manage and curate those libraries. So that's a little bit about IntelyEDU.
Wow, that's incredible. After hearing all that, it begs to ask the question right off the bat. At a high level,
Mhm.
what would you define continuing education as, and why is it necessary?
Yeah.
And why do you feel it's so appropriate for the care setting that we work in?
Yeah, that's a really great question. So continuing education, as I sort of started to allude to a little bit, for those who might be on the call who aren't familiar, continuing education is something that state boards of nursing and medical boards, but we're concerned with nurses right here, and CNAs and STNAs and certified med aides and anyone who holds a professional license or certificate from a state. In most states, there is a requirement to demonstrate continued competence for your license. So all nurses, most everywhere, there are a few outlier states that don't do this, have to be able to provide documentation that they've completed continuing education. Tracy, you asked the perfect question. Do you get CEUs for these courses? Yes. So continuing education units, the ANCC's changed their language a little bit. Now it's a whole different acronym. I don't know. They got to stay in business. It's wonderful. But we've got a whole new language around that. But yes, contact hours for continuing education. We do provide those. So we have to maintain our nursing licensure. And really demonstrate our competence. And why is that important in post-acute care? I mean, we all know You've got to be able to be competent in order to practice and provide care, especially if you're jumping into a building, one off here and there. You got to be able to do that.
Great. With that said, how do you feel continuing education has a direct impact to the quality of care of the residents and patients that we serve? And how do you feel it helps reduce negative outcomes, if you feel that way at all?
Yeah, yeah. So definitely, and actually, I was doing a little bit of deep dive into the literature last week for a totally different project. It's one of the things I really enjoy doing is hitting a nice academic library and getting deep into the research that's out there. And there, I mean, it's very strong. It's also very intuitive and maybe a little bit obvious that the more competent you are, the more prepared you are to care for whatever kind of patient population you might end up caring for. I was literally just reading about this last week, and the not just the competence, but the confidence that you have a competence in whatever you're doing is equally important. So, I think there's a lot of different ways that people come about and come to nursing, lots of different pathways. And for those who might be on the call who might not be familiar, certainly there's about a 1 year education pathway. And at the end of that, people come with a licensed practical nurse designation around 2 years. And we get the associate degree nurses. They are RNs as well, registered nurses. And then there's 4 year degrees, which are baccalaureate prepared. And we actually have even more than that. There are now direct entry masters, direct entry doctoral programs. I mean, there's a lot of different ways to get to education. But when I was a program director for academic institutions, I would do lots of orientations for new students. And one of the things that I felt was so important is helping people understand that what you learn in nursing school, what you learn in your foundational training experience, whatever shape that might be, and they're all created differently. They're not all created equal. That's just going to be the beginning. It's like we're building a house. So when you get your first bit of education, you're setting the foundation for the rest of your professional development. So we definitely, think about when you graduate from a school of nursing or an LPN program, or you finish your CNA, courses and requirements, you're really just beginning to build this house. And the rest of continuing education is putting on the siding, hanging the curtains, putting the pictures up, really doing all of the rest to the house. And then, of course, there's ongoing maintenance.
Yeah. I love that analogy of the foundation and the house.
Yeah.
It really brings to light in a very simplistic format the way in which you can view education and then ongoing education. So I love the analogy. I bring it back to myself in my former life and being an owner operator, and even the best administrators, owner operators, who, by the way, also are required to do continuing education, just like our healthcare professionals, the nurses that we're speaking about here today. Myself, I had to do 20 contact hours a year or 40 every 2 years, depending on the state. And while I found it to be both wildly important and exciting and just empowering because of what it gives you as far as new skills and new paintbrushes in the paint bucket there. I know that not everybody values it the same way that you and I clearly do.
Mm-hmm.
Is there, or can you expand on what are the true benefits of continuing education and promoting continuing education?
Sure, sure. So, I think absolutely, we really need to think of ourselves as lifetime learners. Nurses are lifelong learners, if for no other reason than our personality seems to be in general, and I'm painting with a broad brushstroke here, but most of the nurses I know are always looking for some new thing. That said, there's always some new thing. There's a new medication, a new device, a new way of doing things. I mean, here's something. If we weren't, always learning and trying to keep improving, the reason that we turn patients every 2 hours had nothing to do with being based in science or research or understanding. It was literally, and I'm not making this up, you can Google this, it literally was the time it took the nurse to move around the ward when there were 30 or 40 patients in that ward. That's how long it took to move people from one side to another. So if we don't continue researching and learning and testing best practices, our practice will never change. Hand washing is another great example of that. But absolutely, one of the things that I think we need to mention, and I sort of alluded to this a little before, is that not all professional education is created equal. You had to do your 20 hours to keep your certification. And Tracy in the chat was asking, I think, that PCH administrator licensure. I hear this all the time. Education, and you hear the word education and you can sort of see something happen to somebody's face. They sort of say, oh, education, annual education. Oh, I have to do that. Oh no. There's really there's this flashback, almost this negative feeling that happens to people. And one of the things that was really important to me coming to IntelyCare was to eradicate that from people's experiences. So we set forth, and we spent a lot of time really making engaging, interesting, really consumable and very high quality education for our IntelliPros, for the commercial side, and for the people who need some retraining. We do spend a lot of time. I spend a lot of my time looking for and working with partners to help people move along in their trajectory of their nursing career. I see, Marissa, your question. We work very hard to work with partners, and we have a strong partnership with Excelsior University, for example, where our IntelliPros, who are licensed practical nurses, LPNs, 1 year or so-ish of training, can go back to school at a pretty significant discount and take their coursework. That particular program is 100% online, and really do that in a way that's meaningful for those adult learners. It's very important to maintain competence in your practice through formalized training, going back to school, getting another degree, and to continue your learning through continuing professional development. That's really very important. We need to keep curious, and we need to not just put our heads down and say, this is how we've always done it, this is how we have to do it, because that might not be based in science and won't probably keep us giving the best quality care to our patients.
That's excellent. Marissa's question actually leads me to my next question, and something that I was thinking about as you were speaking is why do you feel that access, or having access, or the idea of education being promoted translate to higher job satisfaction or increased staff retention? As Marissa points out, sometimes finding education is not as easy as you would believe. You and I, that seems a little bit foreign, but it's certainly a thing. And as a former owner operator, I think back to, did I make it as accessible as it should be, and promote it so that it's not looked as a chore, but as something that is going to lead to a greater level of success?
Right. Yeah, absolutely. That's a really great point. I think when we think about the last webinar that we did before about retention and developing ways to foster that commitment to the facility on the part of the workers and to the workers on the part of the facility, it's a two-way street. Something very similar when we think about education. Education is and can be a way for a facility to say, I really think you're important, and I want to keep you, and I want to keep you engaged with me. I remember, this is just because Sean and I work together, we happened to be talking another time about how, bringing in the top tier people to do the live in-person training, that shows your workers that you really value them. by partnering with somebody like IntelyCare or IntelyEDU to provide your annual competency trainings, to your building, to your staff, we can, bring in the stuff that won't as much, because it's always, when you tell someone you have to do something, it's a harder thing than, gosh, I want to learn about A, B, or C or whatever. To have something that's a little bit more engaging, a little less like click through, quick, I got to get done with it. So I think the literature also is very clear about this, that people who feel like their employers value them and provide them benefits that are meaningful to them, like partnerships and pathways to advancing their degree and career, and deepening their practice in a way that makes sense for them, is very important.
It's great. Before I get to the second half of this statement / question, because it is obvious that you have furthered your career and are extremely successful at where you are today. But it reminds me of a small facility that I worked with in the early 2000s, where it was a nonprofit facility. We had a small group of young men and young women, mostly young women, who came to us by way of food service and by activities and through a college program that offered social work internship. And while we did not have a large budget, and I think we should probably make this point clear, that some of these educational offerings, especially with the right partner, are not a huge expense. Sure, they are a time expense, and they do require a bit of resources, but on the list of resource priorities, this is not a big chunk of your budget, but it should be on the forefront of your planning ahead. But I remember back to this small group of young professionals, and they each took advantage of an education program that we had. And to date, all of them are still in long-term care. They are all working as nursing professionals now. And, it's a two-way street. It's something that we as a facility took a tremendous amount of pride in. And of course, they took a tremendous amount of pride in the fact that they started in a certain place in long-term care and now are in critical roles in very large long-term care facilities. But that's a specific example from my past. Do you have an example, or can you share a little bit more about your story on how you took advantage of some of the educational offerings along the way?
Yeah, that's great. It's interesting now with the ability to have, a backwards look. I used to. I'm going to disclose personal stuff here. I used to play with my stuffed animals, and I would teach them things. So this started apparently very early for me. But I was a first generation college student. Neither of my parents went to college, and so I when you said it's a hard thing to navigate higher education and find places where you feel like you can find your voice, find your footing, know who to ask, know which ways to, where the bathrooms are, and answer those big questions is really very important and overwhelming. And having a partner that understands that, certainly somebody like me in that role, please reach out to me if you have specific questions about that stuff, for sure. But yeah, we're definitely, so every opportunity I get, I try, sign up for lots of webinars. I have a really exciting social life of me and, Google Scholar. We spend a lot of time together. I think it's a way to go. But I think I can say, and I'm mindful of our time, that not every higher education program is designed for adult learners. The program I was at a very large university was designed for the 18-year-old college student that just, graduated high school and is spending their entire life in an academic pursuit. That doesn't exist for most people today. And that's why we sought out partners at IntelyCare for our IntelliPros that understood that you're an adult, you have a whole life, you have a whole set of responsibilities. You're not going to be able to take off from work and do your education at the same time. So really important there. But unfortunately, I got to kind of wrap us up a little bit. There are a couple of questions that came in that I want to answer. And if there are other questions that I don't get to, please, I put our email addresses, both Sean's and mine, in the chat. So please do reach out to us. We'd be delighted to have you reach out to us. So we have, I'm going to kind of go back a little bit just to make sure. So IntelyCare today does not have like higher education degree granting programs, but we do have partners that provide that. I think, Marissa, that might be your question. I think that's a wonderful thing. I certainly can help, talk with you about that a little bit, just sort of in big general terms. Certainly how IntelyCare can be a partner with you in that. And Nancy, thank you. Yes, training and annual required training, that like stick kind of approach. You've got to do this, and it really doesn't speak to the understanding that the nurses we have, the CNAs we have, have a tremendous amount of absolutely. Them if you're just interested in checking them out on our website, edu.intellicare.com. You can also navigate there from intellicare.com and search for IntelliEDU. You just have to create an account like you normally would if you were headed to some other online shopping place. We have we've served almost 1.5 million people with Contact Hour issuing courses. So absolutely happy to continue to have feedback there. All right. So last bits, unless there are other questions, you are going to get a recording of today's presentation from by your email. So please check that out. Feel free to rewatch. Again, feel free to reach out to either one of us with other questions. Definitely also be on the lookout for the invitation to our next webinar presentation, where we're going to discuss those actionable strategies to influence confidence, competence, and knowledge of your nursing staff. So there are some things that you can actually take from that next webinar and get on your floors and in with your building and make sure that they have what they need. And then I really appreciate you all. Thank you so much for joining us. This was wonderful. Come again. We'll see you soon. Have a great day.
Great. Thank you so much, everybody.
Bye, everybody.